would like to introduce James Bradley for the panel presentation on what to know about transitioning from pediatric to adult care. So James is a transition navigator at the Hospital for Sick Children's and cross-appointed, of course, at the Toronto General Hospital. He's been with our program for a number of years, and I work with James on an ongoing basis, and it gives me great pleasure to introduce him to speak about what he knows best. Thanks, James.
Thank you, Dr. Williams, for the introduction. So as Dr. Williams did mention, my name is James. I'm the transition navigator here at Sick Kids and Toronto General Hospital. And today I'll be talking about the transition to adult care, but I'll also be talking about the transition to post-secondary school. For the majority of our patients, these two things happen at the same time. So that's something I'll be getting into, starting with the adult care transition. All right, so first just want to acknowledge that although I work in this sort of unique role as the transition navigator, I work amongst a number of great teams. So although these photos are a little bit outdated, there are some familiar faces there. So the Sick Kids team, the Toronto General team, and then of course partnering with SCAGO for this presentation today. So just a bit of an outline and background for my presentation. So I'll start with a background on the transition to adult care. Then I'll move into some of the challenges that the patients that we see in the sickle cell clinic may have when transitioning to adult care. That's based on kind of research and also on just experience of working with people. From there, I'll move on to the healthcare transition process and what I do in my role as the transition navigator here at Sick Kids and Toronto General. Then I'll switch gears a bit and talk about the transition to post-secondary school and some important considerations for young people in that transition. And finally, ending things off on some tips for success during all of these transitions. All right, so just a little bit of background. So here at Sick Kids, we see patients until they turn 18, and that's a pretty hard cutoff. You know, at 18, we do transition all of our patients in the sickle cell clinic over to the adult hospital, Toronto General. Now, when we talk about this transfer, that is kind of a one point in time. When patients turn 18, their care transfers over to the adult center. However, when we talk about transition, it really is more of a planning process. So I've chosen this definition here to kind of describe the transition planning piece a little bit better. So when we talk about transition, we're talking about the purposeful planned movement of adolescents and young adults with chronic physical and mental conditions from child-centered care to adult-oriented healthcare systems. And this is meant to be an uninterrupted, coordinated, developmentally appropriate, psychosocially sound, and comprehensive process. So really, you know, it's a much longer process transition. It doesn't happen just when somebody turns 18, but should be started well before somebody's turning 18. This is a bit of just kind of an overview on our transition pathway, and I'm going to see if my mouse piece works here. Yes, it does. So you can see that in transition preparation, we really start around the age of 12 in the pediatric center. The transition preparation piece happens all the way between 12 and 18. And then of course we have that moment in time at 18 where the care is transferred to the adult system. And then in my transition navigator role, I continue to support people for 2 years at the adult center, which for us is Toronto General Hospital. Of course, the transition navigator spanning the 12 to 20-year-old range here. All right, so knowing that patients have to transition when they turn 18, what are some of the challenges that the research and also patient experience tells us? So we know that during the transition from pediatric to adult care, there can be adherence to treatment plan and medication challenges. So this is a time when young people are kind of developing their independence, building their own life skills. And we can see that there's documented a drop-off in adherence to medication and treatment plans, whether that's you know, taking medication, but also attending appointments with their hematologist or other specialists or family doctor or whatever that may be. So we know that that can be a difficult time, a difficult piece of the transition. We also know that emergency room visits and hospitalizations in a new environment can be very challenging for people and for families. You know, a lot of people have become accustomed to what they've experienced at Sick Kids or at their pediatric center, and the experience can be quite a bit different in the adult settings. Of course, increased life responsibilities, so that natural progression into turning into an adult, which includes multiple life transitions, so going off to post-secondary, which we'll focus on quite a bit today. Also starting new jobs or possibly entering, you know, starting to enter into fields that may be career focused, and then life transitions when it comes to social relationships as well. Of course, saying goodbye to the pediatric provider can be a challenging experience. Many people, patients and families that I see at Sick Kids have been coming to Sick Kids for their entire lives. So they really develop a close and trusting relationship with their care teams. So saying goodbye to that care team can be a challenging process. And of course, moving into the adult care system, there's less of a coordinated effort in terms of care management, which I'll touch on a little bit more here. So this is a table just sort of comparing and contrasting pediatric care and adult care. So pediatric care being on the left, adult care being on the right. And there's some similarities and some differences listed on the table here. Now, the first 6 that are listed in black, I find that most patients and families do know quite a bit about, or sort of expect that to be the case. Whereas the bottom 2 here listed in red are 2 that I find that maybe catch people a little bit more off guard or need a bit more support with learning as they transition. So the first one being that in the pediatric center, there's a comprehensive care under one roof. So here at Sick Kids, we try to coordinate specialist appointments, other tests that patients might need, often on the same day, but certainly under the same roof. So here at Sick Kids. Whereas in the adult care system, there really isn't as much support with coordinating appointments, which means it's a lot more for patients and families to track and sort of fit that into their daily lives. The second one being in the pediatric center, there's a little bit less of a reliance on a family doctor or pediatrician, whereas in the adult care center, the role of the family doctor is really quite crucial. So in the pediatric center, often medical concerns that are brought up can be addressed in the pediatric center, whereas in the adult center, the doctor might say you need to go to your family doctor for that. So of course, even having a family doctor, as I'm sure many people on here are aware, can be difficult to find. So really making that connection is key. So transition navigation. So knowing what we know about the challenges with transition to adult care, what are we doing to support patients and families with that? So as I mentioned, I do start seeing patients in my role as the transition navigator and meeting them and their families at the age of 12. So this gives us plenty of time to introduce the concept of transition planning and start to do those transition planning pieces. We might focus on things like getting a grasp on where a patient's disease knowledge is at and starting to develop some self-management or shared management skills with their parents or families. We'll definitely talk about high school diploma requirements and different pathways to complete academic goals, and then look to what's after high school as well into post-secondary planning. So as I mentioned, this often happens around the same time as transitioning from pediatric to adult care. So it's definitely a large part of our discussions that we have in the planning piece. Can also result in people moving away from their home. So that also we may need to coordinate healthcare planning as well. We'll talk about volunteer at the younger ages, and then employment interests, moving into kind of the mid-teens and later teens. Goal setting around all these different topics, providing resources and referrals, whether that's within Sick Kids or in the local community. And of course, system navigation, especially when reaching the 18, 19, 20-year-old range. So at the age of 18, we also host a transition clinic where patients get to meet their adult provider during their final appointment at Sick Kids. So we do these once a month. We transition about 40 people per year. So meeting the adult, this is an opportunity to meet the adult hematologist while still being in the comfort of the pediatric setting. We do a tour of the adult clinic, which was put on pause during COVID, but we're trying to start that back up now. The option to create a My Health Passport, which is a wallet-sized medical summary of a person's care. And of course, this is the graduation. So it's a little bit of a ceremonial, graduation for us as well. We have a little certificate and a gift that we give patients too. And then at this time, we can talk about booking the first clinic appointment in the adult clinic. So it really is a seamless process. And then of course, we have some of the adult physicians that we work with here listed on the page there. And then the transition navigator, myself, I'll continue to work with patients for their first 1 to 2 years, generally closer to 2 years, around the age of 20, connecting to adult care at Toronto General and within the University Health Network. All right, so knowing about the challenges, knowing about sort of my role as the transition navigator, I wanted to give some tips for any teens that are watching to prepare for the healthcare transition. So number one is becoming an expert on your condition. So knowing about your condition, feeling comfortable starting to talk about your condition, asking questions about your health, really kind of taking the time to learn those pieces of your care. Speaking up for yourself during your appointments. So if you have any questions or concerns with the doctor or your care team, bringing those up when you're at the clinic. taking charge of medication, so setting alarms to remind you if you take medication, and developing a routine that works for you. Also, organizing and keeping track of your own appointments. I'll say the vast majority of patients I see when they're sort of 17 and 18 aren't quite doing this one yet. Maybe they're aware that they have one coming up in the fall or the spring, but really still rely on parents and family members to do this. And then, so you know, taking the time to start to keep track of these is a really good transition preparation skill. And writing down any questions you have for your healthcare team to bring them up during your appointments. You know, a lot is talked about at a clinic appointment. It can be very medical focused. So it's good to come prepared with a list of questions just to give yourself time to sort of absorb what is being said during the clinic appointment and be able to make sure you get your concerns or questions across to your care team. And of course, building a support network. So for a lot of young people, that might be parents or family. But as you get older, you know, starting to expand that support network. So whether that's, you know, key members of your healthcare team, somebody at school that's kind of your go-to person or your point person, somebody at your work who's your go-to person or your point person to talk to. So starting to build that greater support network. And then top five tips for parents or caregivers. So number one, just talk to your teen about his or her health condition. So, you know, having that open dialogue to share, you know, what's going on, you know, do we have any questions for your care team? You know, what do we need to address? And starting to feel that comfort level. Support your teen to see clinic staff without you in the room. So this is a big one that I know is really hard for parents. You know, they want to be in the room to be sure that everything is communicated to the care team, but asking for, you know, or suggesting even to have your child speak to the care team on their own for at least a part of the visit to start to develop those independent skills. Encourage your teen to prepare to take his or her medications independently. Give your teen opportunity to learn and practice scheduling appointments and filling prescriptions, of course, with your support at first, but then kind of tailoring that back as time goes on. And of course, being your teen's best advocate. So, you know your teen best. So making sure that anything you need to communicate to the care team that you're able to do that with your teen. Okay, so that was a bit of a kind of a flyby overview of the transition process. I wanted to sort of switch gears here and talk about the transition to post-secondary school, because that is sort of a major focus of today's session. So moving on to the transition to post-secondary school, I'm going to go a little bit into the background on sickle cell disease and academics. So as we've kind of talked about already, healthcare transition can be a challenging process. Transition to post-secondary school generally happens around the same time or within the same year as the transition to adult care for many, many people. And support, we know that having support in a post-secondary setting can help address some of the impact of living with a chronic health condition on academic performance. So for people living with sickle cell, these might include things like unpredictable absences, of course, for any health issues that you're managing at home or potentially even for hospitalizations. Of course, living with the impacts of pain, whether that's occasional acute pain or longer-term chronic pain, can have an impact on ability to participate in post-secondary studies. Managing multiple medical appointments with different specialists. So again, that ties into the less coordinated care in the adult setting. So having multiple medical appointments to keep track of and do your best to attend. And of course, the impact of stress and mental health as well. You know, this is a time of a lot of pressure, a lot of changes, school being one of those, health being another really important one of those as well. And the cognitive and learning impacts for some people living with sickle cell, which Dr. Jansen will be talking a little bit more about later today. So a study done back in 2006, but looked at people living with sickle cell and how that was impacted in the school setting. And of course, you know, sickle cell is a chronic illness that is invisible in nature. So, you know, somebody can't just tell by looking at you that you live with sickle cell. And they found that there was a real lack of knowledge among educators as to what sickle cell really is and what the impacts of sickle cell are. Another study done in 2015, they found that students living with sickle cell disease, about 60% reported that it interfered with school performance. So we can see that the majority of people that are attending school, you know, at some point, sickle cell may impact school performance. So when starting to talk about post-secondary school and the supports that are available, it's really important to kind of address some of the terminology that is used. So this one, the term accommodation describes a change to an environment or a curriculum format or equipment that allows an individual with any health condition or disability to gain access to content and or complete assigned tasks. So often accommodations will be overseen by a school's accessibility office. So the accessibility office, although it may have a different name, but that's the general title, will be responsible for assessing and recommending different accommodations for students and educating them on school process, policies, and resources to use these accommodations. So what support is available for people as they enter their post-secondary journey? So in the Ontario Human Rights Code, colleges and universities are required to accommodate the needs of students with disabilities, unless to do so would cause undue hardship. So that's kind of the legal definition of what's required. It's determined on an individual basis. Accommodations, as I mentioned, are done through the school's accessibility office. They do call this something different at each school, but that's generally what it's called, something along those lines. And it does require medical and or formal documentation, although you do not have to disclose your diagnosis. So if you choose not to disclose what your health condition diagnosis is, that is your choice. But you will have to include medical documentation generally around the functional impacts of your health condition. And legally, colleges and universities have to provide reasonable accommodations for people living with a health condition or a disability. So knowing what some of the challenges are, what needs to be required to be offered by schools, what are some of the types of accommodations that exist? So the first one being teaching and learning accommodations. So an example of this would be note-taking. So if somebody's absent from class, often there's somebody available to take notes for things that people may have missed. Assessment and evaluation accommodations, so a private space to write exam, memory aids if there's a documented cognitive or learning issue. Environmental accommodations, so strategic seating, private space to write exams, to reduce distractions, and also services and support. So things like sign language interpreters, alternative format text, assistive technology, really the list goes on depending on what supports are needed. But these are the four major categories of accommodations that are available. And some of the examples that I do see with a lot of patients that I support in this transition is is extensions on assignments if they're absent for medical reasons. So if they've missed any school because of a health issue that's come up or a medical appointment, getting extensions on assignments is one of the key pieces to make sure that they have time to complete those. The ability to reschedule exams if absent for medical reasons. The ability to reschedule exams to reduce the likelihood of stress triggering a health issue. So often in college and university, your exam schedule comes out and you might have 2 exams on the same day or 2 exams within 24 hours. So the ability to switch these to spread them out to reduce the chance of stress triggering a health issue. A private space to write exam and extra time to write exam, again, to reduce the stress associated with that process. And of course, note-taking services if absent from class, although more often I see that these are generally available online. Now, I did put an asterisk beside the second and the third point there, because although you're able to reschedule things, it doesn't always mean you're able to do it after everybody else. So often I have seen that professors will say, okay, I see that you have that accommodation, but it's too late now. Everyone's done the test. So they prefer that you let them know ahead of time. So you often have to be proactive in the approach because they may want you to write the exam before the rest of the class, if that's possible. Again, not in every case, but this is something that I have come across before. So yeah, knowing that these supports are in place, it's a bit of a process to register for the accommodation. So it's important to know what that process is. So each school is going to have their own process. I've gotten to the point where I've stopped trying to memorize it because schools keep changing it as well, and every school is different. So the key point is you just have to go to the school's website and see what their process is. Also, a lot during the COVID last couple of years has switched to be virtual. So a lot of schools have changed things over the last couple of years. Generally speaking, you have to complete your medical documentation, which has to be signed by and completed by the student, and also information filled in by the medical provider. And this form is generally specific to the school. You have to send the documentation into the accessibility office. You have to meet with an accessibility advisor to set up your services, which can often be done on the telephone or virtually. And then they provide you with something called a letter of accommodation, which outlines what your supports are available for your semester. So knowing that the accommodations through the accessibility services are one of the key things that patients might want to consider, it's also important to consider what other supports are available within the school system. There really are so many supports at all the different schools. So many offer a summer transition or orientation program. So you can attend school over the summer, usually in August, often being virtual to learn more about what to consider in your transition to post-secondary and give yourself some time to adjust. You can have appointments with a learning strategist, so somebody that may review your learning needs and make recommendations for how you might learn best in the university or college setting. Peer mentoring, so often a student who's taken a course the year before may be available as a peer mentor to help people with course material in the following years. Tutoring services and academic supports are often available through the schools. And then just other, support, whether that's mental health or counseling or social groups. There's all sorts of different communities that are in colleges and universities. It's also a big part of college and university too, is kind of branching out and, learning more about yourself and your interests. So just seeing what else is available in terms of supports, whether that's, formal organizations or just kind of informal study groups and things like that. All right, so tips for post-secondary school. So registering for accessibility services early is recommended with the correct completed paperwork. So I do my absolute best to reach out to all of our patients that I know that are attending school in the summer to make sure that their paperwork is set up for the school year. Even if you're thinking, oh, maybe these supports I'll use, maybe I won't. I didn't really use that much in high school. It's good to have them in place just in case anything comes up throughout the school year, because the pace can be pretty quick in post-secondary school. So be able to describe your health condition and what your needs are. You are going to be your best advocate, especially in the school setting. I find that a lot of the staff that you might be meeting with really expect you to be able to tell them what your needs are. So that includes, a brief description of your healthcare or your health condition, if relevant. But most importantly, what your learning needs are. So what worked for you when you were in high school? What do you think your support needs are? And they'll do their best to match you with those. So research your program and your school's resources. So as I said, every school is going to be different. There'll be a lot of overlaps in the resources that are available, but really kind of diving into your school's website, asking questions, looking around, seeing what's available and connecting. Connect directly with professors if able. So this could be harder in some of the bigger schools. But if you're on maybe first name or a name basis with your professor and a health issue comes up, it's possible that they may be understanding, right? So having your letter of accommodation and your outline supports, but also just if your professor knows that you're a proactive person that comes to them when possible before something arises, then when something comes up where you couldn't plan it, they may be more understanding of supporting you. So I've just this has actually been something I've added to this presentation from feedback from the patients that I support, is once they got to know their professors, things were a little easier. Consider other life transitions. So what else do you have going on in life, whether that's social or, of course, health related, work related, whatever else is going on in life, just make sure you consider everything else. And of course, similar to the healthcare transition, building a strong support network around you. This resource here, www.transitionresourceguide.ca, is actually where I've kind of, I've learned a lot about the college and university transition and academic accommodation process, but this website does a really, really good job of summarizing it, and it's actually Ontario-based. So you can see everything you need to know about accessibility and other essential resources across 44 public Ontario post-secondary schools is on here. And just when I was preparing this presentation, I went to the website and I saw this new course that they have. It's called Eyes on PSE, post-secondary prep course. So it's free. It's a full online module that can take you through all the different considerations you might need to think of when transitioning to post-secondary school. So it looks quite thorough. I do recommend anybody that is on the call and interested in this more to go take a look at this, because lots of great resources there. Okay, so that's everything for me. I think we will be doing questions at the end, so I'll hold off till then. But thank you everybody for your time today, and I look forward to questions when we discuss a little bit later.
James, we actually do have a few moments before Dr. Johnson needs to. Sorry, I think I muted myself unintentionally. There is a question in the chat from Jaspreet. I'll perhaps invite you to answer that in a couple of minutes if you'd like. Jaspreet is a graduate student who's doing a master's designing interventions to support youth with sickle cell disease transitioning to adult care, working with SCAGO. And her question is, why the transitionary supports begin at age 12 and end at age 20. She wanted to know more about the rationale behind this age range. Could you share a bit more about the resources provided at the different stages of the transitionary pathway at SickKids? So a big question, but maybe if you could address very briefly.
Yeah, absolutely. Well, the work you're doing sounds really interesting. So that's great to hear. I'm going to go back up to, where was it? This slide here. Can you see this, Dr. Williams?
Yes, transition showers.
I'm sorry, this is the one I wanted to go to. So starting at age 12, yeah, so this is actually based on the research. So there's a website called Transition, so GOT Transition, which is based in the United States, and they do a lot of research around transition planning for health conditions. And so this is actually our transition program that we developed at SickKids is based on the recommendations from Transition. So introducing the idea at age 12, and I think a lot of that is sort of developmentally appropriate timing to not only, entering the teenage years when patients start to take small steps towards developing those independent skills, but also plenty of time to get to meet and know families and get to know them as a kind of a whole, right? The other piece being that, although I may see people 4 times a year, some people may only come for appointments 1 time a year, right? So between 12 and 18, it's only 6 visits. It's not that many times. So our program is based on the GOT transition model. So in your research, I think that'd be really, really great for you to connect to that website as well. They have all sorts of great resources for transition planning. In terms of some of the things that we use, so the second point here, disease knowledge, and whoops, I thought that was going to do something different. Apologize. Disease knowledge and self-management skills. So we have a sickle cell disease readiness survey that we administer usually between the ages of 13 and 15. So it's specific questions about sickle cell and about kind of comfort level, talking about different topics. So we do that with patients when they're between 13 and 15, so we can get an idea of what information they know really well already and what areas we might need to focus on over the next few years. So it allows us to do some more targeted, tailored support to different learning needs. So that may be done by myself, or if it's something more specific that the doctor or the nurse may be more suited to do the education, I'll relay that to them and they'll do that. In terms of all these other pieces here, we have developed quite a few different resources. So we have, a high school diploma pathway and different ways to get your high school credits, a resource that we hand out to patients and families with that. Post-secondary, we have a pretty comprehensive document that outlines what accessibility services are, different grants that are available, different scholarships that are available, and kind of the links to connect to those. For employment, we connect a lot of people to youth employment programs that exist within Ontario and in the Greater Toronto area. And then just over the years, we've developed so many different, knowledge of different resources and referrals, whether that's for things like counseling or community programs that may be in patients' local communities. And that's an ever-growing list of things, right? But these things change and evolve over time.
So thank you so much, James, for a really very approachable and wonderful comprehensive review of the transition processes that are in place at the 2 institutions in Toronto for sickle cell disease management. To take the opportunity to welcome Dr. Laura Jansen to speak, and she's going to be talking about mental wellness and post-secondary transition in sickle cell disease. Dr. Jansen is a clinical neuropsychologist in the Division of Hematology Oncology who works with many populations within our division, and in particular works with the sickle cell disease patients and does many transition assessments in preparing patients, individuals for post-secondary education. So with that, welcome, Laura.
Everyone, thanks so much for having me here today. It's a real pleasure. So my name's Laura Jansen. I'm a clinical neuropsychologist, and I work with the sickle cell team and others at SickKids. My role has a lot to do with conducting assessments prior to transition for young people with sickle cell disease who might have any form of cognitive or emotional issues that require sort of evaluation and documenting strengths and weaknesses, and really looking for opportunities to support people as they're planning for their transition. So we all know that sickle cell disease can look like many different things. For many people, it's not the same for everybody, but by and large, individuals who have sickle cell disease may be at risk for increased cognitive difficulties or academic difficulties or sort of emotional, psychological challenges. And that's partly because it's a condition that can affect people neurologically. And it's a chronic health condition that, people have to live with for their whole lives. And those two things in and of themselves can increase risk for all sorts of cognitive and emotional difficulties. So even though folks are doing everything right and taking medication and going to appointments, there might still be some issues that require some assessment. There might be learning or attention problems or other factors that are going on in life totally independent of sickle cell disease that you might benefit from neuropsychological or psychological assessment. So some of the aspects of cognitive functioning that might be looked at in a standardized neuropsychology assessment, it really has to do with like breaking down different factors of cognitive abilities and things like attention and processing speed, language, visual spatial skills, and executive functions. And those are like the higher order functions that have to do with planning and organization, sort of how one manages time and prioritizes daily activities, sort of the being on top of everything all at once. That's executive functioning. And that those are areas that can be particularly affected in individuals who have sickle cell disease, and particularly people impacted by silent strokes or other sort of neurological impacts. But they're also very common in everyone, in the general population, right? We all at times in our lives can have, challenges with memory and attention. They're very sensitive to things like pain, to distress, to poor sleep, and a number of other factors. So these are things that we can all have difficulties with at different times. But standardized assessment really helps us to know sort of how big of a deal is this? When did it start? What's likely to happen? And are there any impacts or interventions that might be helpful? So, like I said, a neuropsychological assessment really has to do with exploring sort of brain behavior relationships. So sort of thinking about individuals and what the impact has been of their medical condition, but at a more detailed individual level, really exploring how they might be thinking and learning or using language or reasoning with visual information, how they're paying attention, how quickly they can do that, and sort of in their real life, what's the impact of all of these different things? How does it impact them in the goals that they have and the things that are required of them day to day? And so again, like James said, when we're thinking about access to accommodations in any post-secondary setting, what we require is individualized assessment. So assumptions aren't sort of made that just because you have this condition, you're going to need this. It really has to be an individualized assessment. So it's tailored to answer for an individual, sort of what their strengths and weaknesses are, what the needs are. And that's really obtained by talking to teens and youth and their parents, sometimes teachers, really directly assessing these different areas of functioning and comparing to others of the same age, what's typical or what's above or below what's expected. For many of our young people with sickle cell disease, we might have sort of assessments at different points in time. So often there's assessments when they were quite young, then later on, maybe in the middle school years, then maybe by teen years. So we can also look at how an individual person is performing or making progress relative to themselves. And that's really helpful. So neuropsychology assessments have to do with identifying strengths and weaknesses in an individual, trying to think about what might be changing, especially if there's changes in a medical condition or new treatments, or there's new findings on neuroimaging, really looking at changes that are happening over time. And that's where we're using those repeat assessments or assessing at different ages. Thinking about real world functioning, like, okay, so what does this mean for you every day? Maybe you're struggling with memory, but where is that really getting in the way for you? And how can we try to work around that? And then really thinking about are there special kinds of services or supports or programs or interventions that might be helpful? And again, that can be anything from programs at school, right? So in the high school setting, that could be individual education plans or IEPs, to therapy, or other kinds of treatments, to community services and programs, or to a lot of resources and information to increase knowledge about oneself and sort of why they might be feeling or thinking the way that they are. So just to sort of reiterate what we've heard already about some of the post-secondary accommodations. So for young people with sickle cell disease, as James said, one doesn't always have to disclose the diagnosis. That's okay not to, but there is a requirement that a medical professional or a psychologist verify that there is a medical or psychological diagnosis, right? Typically in the forms, there's a consent to release information, but there generally is some requirement that a professional document that there's a medical condition that has an impact or is likely to impact, and what the implications of that are, or that there's a psychological impact. So for some of the folks I see, you know, their medical condition is well controlled, it's managed, there's not huge impacts based on their well-controlled sickle cell disease. Maybe though they might have learning or attention problems or some other aspect that is the thing that the accommodations are based on. So again, there needs to be some documentation of what that condition is. And for psychological impacts like learning or attention disorders, or mood or anxiety conditions, typically that documentation, there needs to be an assessment within the past 5 years. So that's often a time that that the team is referring for reassessments or maybe first-time assessments, because the goal is to have sort of updated information prior to the transition to post-secondary, so that the documentation and reports, the paperwork is current. And then we heard more about registering with the student support or accessibility services, providing the documentation, again, sort of sharing and releasing the information that's required. Some universities have their own special forms that have to be passed on to the medical team or the psychologist. Other universities just kind of take reports or letters. That's fine too. You just have to know with where you're going or what the requirement is for any institution that you're attending. So these are some of the diagnoses that might be made by a psychologist. And again, they might be in addition to a medical condition or independent of, or sort of the only thing that accommodations are based on. It might be things like learning disorder or attention deficit disorder, autism spectrum disorder, mood disorders like depression or anxiety disorders. These are all things for which any sort of college or university or workplace training program would need to provide some level of accommodations if that was shared with them and those accommodations were like specifically requested. And so we heard a bit about what are some of the things you can access, and again, it might be extra time, it might be reduced workload, flexibility on assignments, There's tutoring, there might be skill development. So really learning how to deal with better study skills, better time management, note-taking support. For some young people, though, who have, quite significant anxiety, there might be other accommodations around really not being requested to talk in class in front of others if social anxiety is a real problem. Sometimes in situations of mood or anxiety problems, there can be accommodations regarding the living arrangements, right? Like in terms of living in residence. Sometimes there's been special letters written in favor of reasons why shared bathrooms or shared living spaces are going to be really challenging. Again, it's really specific to the individual need. And there's very specific things that can be requested just to make things feel doable and more fair for people who need something a bit different. But it can extend all the way from the classes to, the living on residence, to things like, where people park or how they access or are transporting from one building to another, sort of a whole range of things related to the post-secondary educational experience. So as we know, there's a lot going on at the time of transitions. And, I think it's just so important from a psychological perspective to realize anytime there's change in our lives, even if it's good change, even if it's really awesome, it still brings a level of stress to us, right? People who are moving to a new house or win the lottery, they actually have extreme levels of stress, right? Because now there's new decisions that have to be made. So moving on to post-secondary comes at a time of a lot of changes. And I think recognizing it's a time of stress, it might be good stress, but we really have to kind of anticipate that we might need to be a little more kind to ourselves and really consider maybe it's time to slow things down or ask for help or try to sort of be really organized, right? To manage all of these things that are happening at once. So the stress or the changes have to do with often leaving home if you're attending school or training in a different city than where you live. It might be actually starting that new program, sort of jumping into the unknown or the unexpected, not knowing what it's going to be like or having a lot of questions about the decision. I know for a lot of young people, it's very difficult to know what direction to go in and to feel like maybe everybody else seems to have it figured out what they're going to do with their lives. And I'm not sure what direction to go in or what choices to make or what's right for me. That can certainly be part of the stress for people, is comparing themselves to others and feeling like they don't yet know what direction they want to move in. There's issues at that stage of life around relationships and what are the meaningful relationships in teens' lives, and will they be maintained following transitions or moves to new places? Will high school relationships be maintained or not? Thinking about finances and new pressures related to money and funding different experiences. We heard a bit about sort of increased responsibility related to appointments and medication, but also really thinking about looking after yourself. And this is really a time of kind of exploring, what do I need and what do I need to be happy and to feel successful in the things I'm going to pursue. So there's a whole lot of things that we've already heard around what you can do, but I think from my perspective, a lot of it is managing this stress. Even though it's good change, it's still stressful, and we need to acknowledge that it's there. So strategies to manage stress are really important, and that often starts with the most basic things around eating, sleeping, resting, being good to ourselves, monitoring how stressed or anxious we might feel, thinking about mood symptoms and what that might look like. trying to achieve some level of balance, right? That we don't want to be sort of all focused on only one aspect of life, but really recognize that there needs to be, focus on the schoolwork or sort of the serious stuff, but also on fun and having social connections. I think really spending time in terms of planning and organizing and really trying to set goals and think about sort of what direction you're going in and breaking things down into the steps that you need to take to get to those goals. All that planning and organization is really time well spent. There's lots of avenues for support and help, and joining support groups or talking to other young people who are going through the same thing can be really, really helpful. Around some of the academics, of course, tutoring and different study skills workshops can be very helpful. And sort of as the learning or academic work becomes more challenging, we really want to remember that sort of across the board, the more active you can be in your learning, the better you will understand and retain and remember the information. And so that's really, those strategies have to do with like actively organizing information, actively trying to explain it, like as if you were teaching it to somebody else, writing study notes or categorizing it, or reading something and then watching sort of a documentary on that same topic. Really anything other than just passively reading information, just sitting in a class, having somebody talk to you. Those are much more passive strategies, and information is not encoded at a deep level when we're just sort of passive recipients, right? The way it will be remembered and comprehended has to do much more with sort of the active strategies and really making time for that. So thinking of psychological needs and what are the interventions, what kinds of things might be identified or be relevant at this stage. All universities have psychology or counseling services. There's access to free, confidential mental health supports really at any college or university setting, or at least sort of resource networks for people who feel that they could benefit from support. That's available. It's just a matter of checking sort of wherever you're at, what's available, and identifying sort of whatever is the right fit for you. There certainly are different kinds of treatments, right? And we all know that there may be, pharmacological treatments for things like ADHD, for mood problems or anxiety problems. Those are things that would need to be discussed with the medical team and discussed, with a physician in order to access those kinds of treatments. But usually those aren't recommended sort of as the only thing. Often there's other strategies or behavioral supports or therapies or interventions that are recommended at the same time, or for some people instead of medication. And cognitive behavioral therapy is one particular kind of treatment that has a lot to do with linking how we think with how we feel with what we're doing. And trying to sort of intervene at those different stages of thinking and feeling and doing. It's been shown to be highly effective for young people who have anxiety or mood problems. Can also be helpful for people who really don't have those issues but are dealing with coping with pain, and really working on well-being when people are experiencing chronic pain, and sort of having strategies to cope with that when the pain is really challenging. So that's sort of one avenue to explore, and there's a whole lot of resources online and sort of mental health resources related to cognitive behavioral therapy as a strategy that a lot of people can use, self-help kinds of resources to access.
And you've gotten us back on track for timing. So we will defer questions to the Q&A session so we can move to the next group of speakers. So The next two presenters are Ms. Gina Mitchell and Ms. Gail Lilac, who are going to be sharing their post-secondary school experience.
Transitioning, basically how to become an adult. I think we're all still trying to figure that out. Even when you get into your 30s, there's so many things that, you know, life throws at you and so many different changes. And there's just a lot that goes on in life in general, that transitioning is always a continuous process. So don't feel like you're behind the game or you don't know what you're doing because you're wondering what's up next with post-secondary. Post-secondary is just another chapter towards your book. And so for me, a little bit about me, of course, like you all, I grew up with sick kids. And afterwards, I realized I love nursing and I want to do that for the rest of my life. And so I decided to go to Fanshawe College and Western University, their collaborative program, so that I could pursue that. So currently I'm in my 4th year of nursing and I'm finished in December because I decided to stay a little longer and just fast track during the summer. And I transitioned from sick kids back in 2019, so right before COVID. That in and of itself, it was just a big transition because you went from everything I had known, which was all in person, which was all great, to a new environment, I think 1 or 2 appointments to transition over, and then everything was online because of COVID. So that was a difficult process. In addition to that, I went to Western University and Fanshawe College, meaning I moved away from Brampton and the GTA, and once again, everything I'd known there. So the real challenge was no longer finding those resources like I would at sick kids, just, oh, let me go talk to my nurses or doctors. The transition was socially, just overall. So after that, I was at Toronto General Hospital in University Health Network. And because I was in London, I decided to transition over to Victoria Hospital. And that's also because I felt like I wasn't really getting the support that I needed back in Toronto because of just the distance alone and the 2-hour drive and then my schedules. And so up here, I started seeing a hematologist, Dr. Soul. And once again, speaking of transitioning, that was a whole other segment of transition. And finally, now here we are. I'm currently in London, Ontario at Victoria Hospital and going forward with treatments. So what I wanted to kind of point out from that journey is, of course, the fact that there's been a lot of change, but there was specifically one example in particular I wanted to highlight to everyone, which is in the end of 2019, I had very painful like periods and stuff like that. And I wasn't sure if it was related to sickle cell or not, but it can be. And so we were supposed to get an ultrasound done for that. Then because of the transition, instead of doing everything under one umbrella, which is sick kids, I'd have to go to St. Mike's. And then I left for school and poof, there goes my ultrasound, forgot about it. So next I went to my family doctor back in maybe 2020, because I started feeling the same kind of pain. I said, okay, this is unusual now because it had mellowed out and it was at a different time period. And my family doctor, who I'd known since birth, essentially said, oh, you're in nursing, maybe it's in your head, maybe you're reading these things and now you're feeling it. And I said, oh, okay, well, that's a little dismissive, but it's fine, I'll go home. And now fast forward to 2022, that same kind of pain reoccurred and it was more intense. And I'm not like someone who likes to take pain medications because of hydroxyurea and everything else. I feel like I'm already on enough medications. If I can bear the pain, it's fine. But it was an unbearable pain. And I actually ended up going in to a walk-in clinic and just asking them, hey, can you give me a referral to just do an ultrasound, an abdominal ultrasound? And they noticed that there was actually 2 large cysts and one had actually burst. So that's where all the pain was coming from. I say that to say, if you have any concerns or if you feel like something's not right, you have to advocate for yourself. That's a part of the journey I wanted to highlight, is with all the transitions, all the changes, you have to make sure that you're advocating for yourself. And a lot of what we've learned And a lot of what our nurses at Sick Kids and our doctors at Sick Kids were so good at doing is making sure that we always receive the best care possible. And so then when you transition on your kind of own and you're more in an adult world, it's easy for people to kind of dismiss you because you were in pediatrics, because of your background, because maybe like me, you're in the healthcare profession. There's a little bit of power dynamics between the hierarchies. And all of that is to say, don't let that happen. Just continue to advocate for yourself if there is ever a concern that comes up. I really wanted to highlight that because I feel like it's a really important part of transitioning. But on to the next part, which is the academic life and just making sure that you're getting your accommodation, taking breaks. I also want to highlight that, once again, as Dr. Lorian highlighted, eating and studying need to coexist. You need to make sure that you're getting your rest, you're eating, and everything's going well. If you have accommodations, definitely utilize them. Make sure you're taking your breaks. Make sure that you're listening to your body and staying on track. And the next thing that I wanted to do is just kind of highlight some tips that I have. So you can always ask for help. And the first step for asking for help is admitting that you need help and admitting that like you might not know what resources to go to. And if you don't know which resources to go to, seeking out someone who maybe does, maybe someone who's older, maybe a mentor. And that's how you'll find those resources and find people who can help you navigate those situations. The next thing I want to say is highlighting a DIY, but DIF kind of mentality. So doing it for yourself, making sure that you're following your medication regimens for yourself, making sure that you're staying on top of your healthcare for yourself, of course, because once again, coming from pediatrics where our doctors and nurses are so involved and they're so amazing, then going on and doing it yourself, you really have to kind of put your best interests always first, whether it's socially, whether it's within the university context. Just make sure you're looking out for yourself, because transitioning from pediatrics to adult, it can be really difficult. It can be a challenge. It can be something that you're prepared for since the age of 12, but when it actually comes, it's a little different. And the next thing I want to say is find the team for you. So if you feel like you're not being best supported, for example, in my case, by my family doctor, sometimes we outgrow certain situations. We have to find different resources, and that's okay. So you can always find a team or a healthcare resource that's better for you. If you feel like your professor might not be listening to your concerns, might not be willing to give you accommodations, that's okay. There's other professors, there's other people you can go to. Your professor might not be listening to you essentially, but you always have other resources. There's, as I like to say, there's always a boss. So if you're not getting the results you want from one person, then you just reach out to other resources, and don't be afraid to do so, because that's how you're going to look out for your best interest.
I think those were really wonderful experiences to share, and especially the part about taking initiative and really charting your own course. Phenomenal. Gina, please go ahead.
Hi, everyone. I wish I had a presentation and everything, but I don't. I started transitioning around 2016, actually, and I attended university in Brantford in 2017. My experience was quite difficult, to be honest with you. I do want to say that it's very important to kind of really understand the accommodations that are going to be available to you, and getting in contact with your accessible learning center beforehand. When I was going through my transition, I met with my transition navigator, and they were so amazing. They helped me fill out all the paperwork so that as soon as I started school in September, all my accommodations were already in place, so I could just kind of focus more on like the new responsibilities I had, and not the stress of like, you know, trying to figure out accommodations while trying to figure out campus and stuff like that. I'm always opening to sharing like what kind of accommodations I had. So typically mine included like doing exams in another space, getting extra time. I do get a lot of pain in my wrist, so sometimes that doesn't allow me to write. So during my exams, sometimes I would have someone write for me if I was unable to do so. I also advocated that, you know, I wanted to have access to water during my exams and food. So they allowed me to do that, as well as I did have assistive technology. That meant sometimes I would have my textbooks be in a digital format and so forth. It's very important to focus on your mental well-being, especially when we're transitioning from sick kids or the pediatric side of things, that we are now in control of our health. And if we are not proactive in that sense, we're going to drop the ball. So I always want to say, you know, you're going to see your peers like eating fast food, pulling all-nighters, not taking care of themselves. And that's something that when you're in that environment, you're going to sometimes adapt, and you have to be proactive in saying, hey, I need to get a good meal in today. I need to drink my fluids. I need to get the certain amount of sleep. I need to start my assignments beforehand because I cannot be pulling all-nighters. It just doesn't work with my body. You don't do that. So it's always best to kind of, when you get your assignments, I was a huge organizing freak, and I suggest everyone become one. So basically I got all my syllabus, I write everything down and be like, okay, I need to have this done, this done, this done for these dates. And so that means I need to start at this time. So I give myself accurate time to do the work without being too stressed. And also for exams, I always had mine 1 exam per day. So that doesn't mean like, so if I had 2 exams that fell in one day, that meant the next day I would have to do the other exam. It wasn't like they're giving you 2 weeks to do that exam, like you're doing it the next day. So you have to study and be prepared, give yourself accurate time, because you don't want to push yourself into a crisis and trying to think you can pile so much things on. It's always important to ask for help when you need it. With me, I had a lot of difficulties at first trying to advocate for myself, but once I learned the skills and I learned how to ask for help, and sometimes that involved, you know, reaching out to Larnie or reaching out with my mom to kind of say, hey, like, this is what's going on. I don't know how to deal with it. Do you have any suggestions? Just to kind of get another point of view and see how I can deal with that appropriately. But that's pretty much my experience. I don't want to go too much over time, but if you guys have any questions, I'm always happy to kind of elaborate more. But it's very important just to kind of be proactive and make sure you give yourself an accurate amount of time to do the homework, do the assignments, and reach out to your accommodation center so that you have everything lined up so you could just focus on, you know, getting work done, getting your grades that you want to get. Also very important to go to office hours with your professors, meet them, explain what sickle cell is, because when they put a face to the name, they're more likely to want to help you succeed. If you didn't understand the assignment or you were gone for a period of time, reach out to them and say, hey, I didn't understand this. Can you explain it to me? Go to the office hours, let them see your face, explain to them what your condition is, let them know, because in my experience, I didn't have one professor that knew what sickle cell was. So it's hard for someone to want to help you if they don't even understand what's going on. But yeah, thank you for listening to me talk. Again, if you have any specific questions, I'm happy to answer them, but that's kind of like the rundown. Thank you.
Thanks so much, Ogina. That was really lovely to share your journey and some of the things that you had to face in your transitions, accommodations for high school students when the sickle cell disease starts to impact school and attendance. James, since you've answered, I don't know if you perhaps just wanted to speak for a couple of minutes here. I know Dr. Jansen also touched on it in her presentation about accommodations prior to transitioning to post-secondary school?
Yeah, absolutely. So yeah, I responded in the chat there. The question was about supports for people with sickle cell, but in high school. So of course, when I was speaking, I was speaking more to that transition to post-secondary school. So what I've seen in terms of the high school years is generally the supports, all the same supports are available. However, it kind of goes into two streams. So one stream is the informal stream of supports. And one is the more formalized stream, which is the IEP, or the individualized education plan, which Dr. Jansen spoke a little bit about. So often what I'll see is that people are documented as needing informal supports, which is often access to a resource room, private space to write exams, more time for exams, and then the flexibility in terms of assignments if you're absent for health reasons. So that'll often fall into kind of the informal piece, but often they'll still need just a letter from your healthcare team outlining what that is. So we can write individual letters, but there's also an About Kids Health website, which outlines sickle cell disease for teachers, so that can be provided to the school as well, which gives kind of a thorough overview. So those are two of the things we generally do. If people need more formalized supports through the IEP, there's a process to put that in place. So each school has a meeting a couple of times a year. I think it's called the IRPC or the IPRC, where they review patients' needs and then they formalize an education plan. So that would be more along the lines of if specific learning needs are outlined, whether that's like neuropsychology testing done that Dr. Jansen would do, often that'll go through the IEP process. So you kind of have those two streams, and it's about balancing, okay, are the informalized supports enough for me, or do we need to push this to an IEP where it's a formalized, documented support system in place for me? One other thing I'll mention on that is if you do have an IEP in high school, when you go to get set up with your accessibility services in college or university, bringing a copy of that with you, because that'll sort of speak for you as well, right? That'll say exactly what your learning needs were in high school. So having a copy of that yourself.
Thanks, James. I don't see any other open questions, but I did have one for Gail. Just because she shared very personal aspects of her journey, but a very practical one. When Gail, you spoke of identifying a physician at Victoria Hospital because your needs weren't being met by the management at the Toronto General, or the home team, so to speak, because you were living in London. How did you actually go about identifying who that physician was going to be? Did your Toronto team facilitate that for you? Or if you did that on your own, how did you actually find Dr. Soul?
So actually, Dr. Kirby, before I even left, she had someone who went to Western, one of her children. And so she was telling me, there's an amazing, everyone was always saying, there's an amazing physician over in London. I was like, okay. But I think anyone who knows me knows I love sick kids. I was like, I don't really care. I'm still going to be in Toronto. So then there was actually a period where I was like not really seeing that much, and I was like, okay, this is very different from every 4 to 6 weeks going to sick kids. And I said, okay, something needs to change. So I asked them at Toronto General, like, how can I go about seeing Dr. Soul? And they put in a referral. I did not act on it immediately. I was still skeptical to be honest, especially after that negative experience with my family doctor. I was like, I don't really know if I want anyone to see me for now, if I don't feel like my concerns are gonna be taken seriously. But then it was actually over the summer that I realized I need supports, and I'm not gonna get it if I don't go and make those moves myself, because physicians can put in the referrals, they can like try and set up an appointment, but if you don't go and try and actively participate, it's not going to happen. And like I said, I'm also in nursing, and so I had a patient who also had Dr. Soul and shared with me she was in the hospital for a sickle cell crisis, and I was saying, I never had one before, what is it like? We were discussing, and she said, Dr. Soul's amazing, Gail, go. And I said, okay, fine. That was kind of like the nail on the head. When your own patient recommends you to a hematologist, it kind of solidifies the fact. And then I went, and I felt so supported that I was like, okay, I'm thinking I'm gonna stay here. I actually contemplated staying in London just to stay with the healthcare team, but I was like, I want to go back to Toronto. So that's kind of how it happened. They put in the referral. And I was hesitant, but then eventually I went and I acted on it, made those appointments, and then continued with the follow-ups. And now that's my healthcare team over here.
Perfect. Thanks for sharing that, Bill. I think that's really helpful for people to hear just how to navigate those pieces as well. Lanry, I see you have a hand up. I think you would like to speak.
Thank you. Thank you so much, Susan. And thank you, everyone that's been on these amazing presentations. I'm listening and I'm like, wow, this is amazing. I wanted to comment first on Ojina and Gail. I think they got it right. I was very pleased when they mentioned that you got to pick what you need to do. I remember my daughter also finished many years ago at Western University. She doesn't have sickle cell, but she recognized earlier on. She said, Mom, there are 3 S in the university: study, sleep, and social, something like that. She said, you got to pick 2. You can't have all 3. He says, so if you want to really excel, even without any health condition, you got to sleep, you got to study. A little bit of social if there's time, but you don't focus on social. So, and I so much love how you, Gail, and Ojina, in your talking about how you, are supporting yourselves through post-secondary education, that you're recognizing, like Ojina said, you got to recognize people who are having the nighttime, the night outings. I can't do that, right? So what kind of food is good for me? People might be doing McDonald's and all of those stuff. Is that really good for me, right? So I think knowing your limitations is so key in ensuring success in post-secondary. And I always say to my daughter, there's nothing wrong with social. She said, yes, Mom, I'm not saying no social at all, but you got to manage your social that it does not overtake your studies or your sleep. Sleep is important and study is important. And I think also you all said it, like planning ahead, being organized, and seeking help when you need it. Don't ever think that, oh, the school can't do this for me. Whatever you need, let them know. If they're not listening, you have the advocacy organization. There was one particular year when one of our students in nursing didn't know that she needed to let the school know in advance that she has sickle cell. So the school didn't know, there was no plan in place for her. And she missed all the practicum that nursing students do, all of those stuff. And the school's like, well, basically you have to come back and re-enroll. It's like, you've not even been here. We walked through it with the school. Yes, the practicum is important, but what they did is that she has to start all over again, but she didn't have to pay the tuition. So there was still something that was able to do, and she learned from that experience, but the school still will be able to see how can we accommodate. So don't be afraid at all to say, this is what I need. This is what will help me. I love when I was looking at Dr. Jensen's presentation, and I think in one of the slides there, I saw things around, like what the accommodations that you can ask for. I think James also touched on that as well. And I've seen things like even for mood depression, I'm like, wow, that's huge. That's great. Anxiety, that's amazing, right? I didn't even know that you can ask for accommodations around anxiety and stuff like that. So there is so much that maybe we don't know, but it's out there. It's always good to ask, right? And so thank you so much for the amazing, amazing presentations. And I really want to thank also Dr. Jensen and James Bradley. You've been doing this with us, and Dr. Jensen for so many years. Like, it's just amazing that we can't even think about this particular yearly session without the 2 of you. Thank you so much for the contributions you have put into this into the planning of this session over and over and over and over again. Thank you so much. Now to the part that we've all been waiting for, where we'll be celebrating our peers with sickle cell disease in post-secondary. At this particular moment, we're so excited to showcase our grant recipients for this year. But before I do that, and before I call on the first person that will be introducing the first recipient, I'd like to really introduce these awards, right? And I'm wondering, Dr. Susan, the two scholarships. So Sunday Afolabi Scholarship Grant. This was introduced by SCAGO in 2005, and that actually was the reason for the establishing the Sickle Cell Awareness Group of Ontario. Sunday Afolabi was born with sickle cell disease to a middle-class family in Nigeria, West Africa. And he grew up knowing that he was very special and very brilliant at the same time. He would sometimes make comments such as, God must know why I have to bear this cross. But I look forward to a day where no one will ever have to suffer from sickle cell disease again. However, Sunday did not let anything, not even sickle cell, deter his focus. And he graduated high school in flying colors in 1986. He moved to the University of Ibadan in Nigeria, West Africa, in 1987 and studied electrical engineering. He finished that program in 1992. He got a job at one of the largest hospitals in Lagos, Nigeria, as an engineer. He later became the head of engineering in this hospital until his death in 1999, a few days before his 38th birthday on October 12, 1999. Sunday Afolabi was my brother, and it was his death that motivated me to start the Sickle Cell Awareness Group of Ontario. And in his memory, since 2005, given his love of education, we have continued to present Sunday Afolabi Scholarship to youth who are seeking post-secondary education. And we hope one day we will never lose one more person to sickle cell disease. I would also like to introduce the Sholape Animashawun Scholarship Grant. Sholape Animashawun, this grant was established in 2010, which was a year after the passing of the late Mrs. Sholape Animashawun. Sholape Animashawun was a wife, a mother, a daughter, and a friend who dedicated her life to helping and assisting people, regardless of background, religion, or status. While in Canada, she worked at CIBC and TD Banks. However, her burning desire to become a nurse, where she could trade her skill for humanity, especially for people who are experiencing an illness, pushed her into a 4-year nursing program at George Brown College and Rising University in Toronto. She completed the program in 2008 and was working at Brampton Hospital in 2009 when she suddenly took ill and died at the early age of 45 years. Now, Sholape did not have sickle cell disease, but was a volunteer with Sickle Cell Awareness Group of Ontario before her passing. And as a nurse, the family then decided that they would sponsor her yearly grant, and they've never missed 1 year from 2010. And so I am so pleased and so proud, of both of our scholarship grants and what the legacy of these two individuals are doing in helping and improving the lives of young people with sickle cell disease. So without taking much more time, we go on to the slide on the scholarship. Thank you very much. And I will introduce the first presenter of this grant. And so give me 1 second. We will introduce Dr. Dana Powell, who will be presenting the Perry Hannah Dickinson grant. Scholarship to Perry Hannah Dickinson. A little bit about Dr. Powell. Dr. Powell completed her PhD in physiology at the University of Toronto and the Hospital for Sick Children. She's passionate about using her medical expertise to bring awareness and education to the sickle cell community and advocating for families. In addition to serving on the board at SCAGO, she also supports SCAGO's social media platforms. And I can't remember when Dr. Powell joined SCAGO, but she's amazing, supporting in various ways. And as such, I will be inviting Dr. Dana Powell to present the first recipient, Periana Dickerson, with the Sunday Afolabi Grant. Thank you.
Amazing. Thank you, Mrs. Lonry, for that wonderful, kind introduction. It is my pleasure to be here and to present this award to Periana. Let me tell you a little bit about Periana Dickinson. She's a peer with sickle cell disease and a mother to an 18-year-old boy who keeps her inspired to be the best role model she can be. Most of all, she has been challenging every barrier and is convinced to be the hope for the hopeless with sickle cell disease. More recently, she has found her purpose in advising and encouraging others about the life challenges of sickle cell disease. Being on this journey has now launched her into the educational path to study social work, to be able to better support the sickle cell disease family as she works her way to becoming a counselor. Periana is honored to be the Sunday Afolabi Scholarship recipient in 2022. Periana, it is our pleasure as a SCAGO board member for me to be able to present this to you. We are excited to present you with the Sunday Afolabi Scholarship Grant for this year, 2022. Amazing.
Thank you so much, Dr. Powell. Periana, if you would like to say one or two words, you have about 5 minutes to, talk about your thank you, your journey, and so on. Thank you.
Thank you so much, Lanry and Dana and everybody else that is here to support us in this journey. Oh, my hat is so full. I'm overwhelmed. I'm quite surprised as Dana, and I just know that we've had such a connection while volunteering at Sick Kids for SCAGO. So a little about my journey. First, I just want to say I'm beyond honored to be the recipient for Sunday Afolabi's scholarship this year. As a child with sickle cell, my educational path was very disruptive with crises. And so I always said to myself, education and I were just not friends. But in the back of my mind, I always felt like we had unfinished business. So as an adult right now, I've decided to take on this challenge and pursue college. As I listened to Sunday's, just his, his mantra, he said that, God had to know why. This, for me, this speaks volume to me, because in my own self, I couldn't do it without God. And so that is why I'm on this journey right now. And to be a recipient for this scholarship, I feel like I'm walking in that living testimony of what he lived by. And to be able to go to college, and just hear the other young ladies here just speak of the experience. I had so much challenges in the Caribbean with the healthcare system and all of that, but fortunately enough, I'm here in Canada. I didn't have sick kids, but I do have the privilege to be at Toronto General Hospital and just have all these amazing physicians team up with me and just help guide me through this journey. When I hear Dr. Jensen speak and just the psychology aspect of things with sickle cell, this is where I am right now. So it really speaks to me. And though I am not challenged with health crises, psychologically being in school right now as an adult, one of the things that I have been battling is just being able to just be attentive, control my anxieties and all of that with the assignments, the time spent. And so time management is definitely what I'm struggling with right now. And I'm also honored to have all these resources that the school has been provided me with, and I am using this to the best of my ability. And so one of the messages I have here for you as you'll continue this journey in your education, also, I want to let you know what's been working for me is giving yourself permission to know your limits, to not compare with others, and know that it is okay to know that you can drop a course and pick it up later. That does not make you less of a person because everybody else is doing it that way. That doesn't mean you have to do it this way. And also, because these are the challenges that I am battling, where you feel inadequate because you're not doing it like everybody else. Your story is your story. And so just own that and give yourself permission to do that. And so I just want to say thank you so much for that opportunity to just receive that scholarship grant. I adore Miss Lanry for just pushing me to just be who I am today. She challenges me, and I just love that, because sometimes I just don't see it in me. I always feel like, no, Miss Lanry, I can't do this, I'm not able to, and all that. But she's always telling me, you have what it takes, and don't give up, Periana, and I believe in you. And the team here with SCAGO, I am so honored to be a part of that family. I couldn't have done it without SCAGO. So I am just so honored to be that recipient here today. Thank you.
Periana, you're too kind to us, and congratulations again. We are so happy that you're continuing your post-secondary journey, and we're here to support you every inch of the way. More grace to your elbow. And we go to the next recipient. And before we do that, I would like to introduce again Mr. Delani Ines, who will be presenting the next award. Mr. Delani Ines brings over 11 years of experience working in public health research, digital health, and most recently, equity, inclusion, and diversity. His interest in advancing the equity of sickle cell disease care and health promotions activities such as genetic screening stems from his time supporting the ethical, social, and cultural program for the Bill and Melinda Gates Foundation's Global Health and Global Development programs at St. Michael's Hospital and the International Network for Evaluating Outcomes of Neonates at the Maternal Infant Care Research Center at Mount Sinai Hospital. Delani has served as lead for the Postgraduate Medical Education Global Health Education Initiative, GAI, for residents and fellows from 2010 to 2019, and the Global Health Mini Masters Summer Program for grade 7 to 12 students since 2016. Mr. Delani Ines is a board member at SCAGO and is also the chair of the education committee. You all have been seeing him today, helping with today's program. And without taking much more time, I will have Mr. Delani on the platform to introduce our next recipient, Rosemary Okebono. Mr. Delani.
Thank you, Ms. Lanry. As always, I want to sing your praises because this feels like a great celebration of not only the work SCAGO done, but the identification of these fantastic folks we have on the call today. Is much of that credit goes to you, Ms. Lanry, and I appreciate the warm welcome. So to your point, I have the pleasure and the privilege to announce the next recipient of the Sunday Afolabi Scholarship. This one is being delivered to Ms. Rosemary Okebono. She is a championing peer, currently living with sickle cell anemia. She was born in Nigeria and recently relocated to Canada with her family, having faced several hospital visits in Nigeria and seeing firsthand the significant difference in both healthcare generally and how it's provided in Nigeria compared to what's in Canada, this aroused her aspiration and led her to aspire for a career in the healthcare field. She decided to embark on this to help prepare for a future role in which she hopes to bring awareness, advocacy, and enlightenment to the general public about sickle cell disease and its symptoms. So living with sickle cell anemia, she tends to remind herself always that sickle cell is not a death sentence. Although life-changing, challenging, and bringing a variety of experience, that it has brought out the best in her. And with this, she's learned to cope, survive, and most importantly, strive while attaining the best she can in every circumstance in all her endeavors. Her hobbies include a variety of things, including reading, watching movies, listening to music, but most importantly, we're here to honor Rosemary as one of the recipients of the Sunday Afolabi Scholarship. So all the praise and pleasure to you, Rosemary. Congratulations.
Thank you so much. Hi, thank you all for being here. Who said living with sickle cell can be a death sentence? Well, we are the difference and we make the difference. Hi, everyone. As Ella introduced, my name is Rosemary Okebono. I was born in West Africa, Nigeria, and then I moved to Ottawa, Canada with my family. My mom is Augustina Okebono and Mr. Anthony Okebono. At an early age, while preparing for school, I had an incident where I slumped and I got to the hospital just for me to discover that I was later told I had a sickle cell anemia. But please, I will ensure that you guys don't call me that, but I'm a warrior in all possible ways. This scholarship goes to God. I would like to give my all thanks to God who made it possible for me to meet with good-hearted individuals throughout my journey and helping me push through the crisis. I would like to give my ultimate thanks to the SCAGO. Thank you guys so much for finding me worthy recipient. I so much admire that. And also I'd like to thank my nurse back home, Mrs. Ulueme. Starting from the onset, you made me understand that living with sickle cell, it's not a death sentence. You're a loving, caring nurse who made me and pushed the inspiration for me to become the nurse, which I hope to go study right now. I also like to thank Veronique Cullen, my new social worker at the General Hospital. We just met, but you took it upon yourself that I nailed the scholarship. I want to thank you so much. I want to also give my thanks to the hematology unit at the General Hospital. Thank you guys so much. You guys rock like rock stars. Nurse Colon, Nurse Cynthia, Nurse Cheryl Ann, you guys rock like rock star. I'd like to thank you guys. I also like to give my thanks to my family, my little sister. She so much shows me what love is. I would like to thank her so much. I could remember the times when I go for my clinic visit and I get back and the bandage is still on my arm. She sees that, she's like, she gives me a hug, peck, kiss. All of that, her show of love is just unquestionable. I also like to thank my dad for his accommodation during my crisis. And he makes sure I get the most possible help that I can while striving in the fear of God. Also, Mom, I'd like to thank you so much for showing me how to be an independent woman. You showed me what it means to be independent. During my crisis, you also push, you make sure that I get the best in my health, and also you also made it possible that I do not rely on the status quo of this condition, but to strive above that. I would like to thank you, Mom, for caring for me through the crisis. I also finally like to thank SCAGO. Thank you guys so much. You guys are so exceptional. When I came into Canada, I was lost, but you guys I was lost in terms of my health. But when I discovered SCAGO, I found out that I am not alone. I could reach out and find the help that I need while embarking on such. Thank you all for listening. I hope not to disappoint. I hope to use the scholarship as best as I can while studying nursing. Thank you all so much.
Thank you so much, Rosemary. Oh my gosh, you're so inspiring. And we wish you all the best as you continue your journey in your school. We are here for you. Don't ever forget that, okay? We are here for you. Zaire Edward is not a stranger to us at SCAGO. He actually was one of our Sunday Afolabi recipients last year. And Isaiah and his mom are also very, very, very strong advocates and, supporting the sickle cell communities for many years. Now, Isaiah is currently attending Centennial College in York University, where he is working towards his liberal arts degree. Through his studies, Isaiah seeks to develop a deeper understanding of human behavior and cultural relations influence on our social and institutional structures. Isaiah's future aspirations are to work in a professional areas of law and or mental health and well-being with a specific focus on Black men. That is original Isaiah. Isaiah, like I mentioned earlier, is a 2021 recipient of the Sunday Afolabi Scholarship Grant, and we're very honored to also present to him this year the Sholape Animashawun Scholarship Grant that is administered by SCAGO. I will have Isaiah give a few words. You have about 5 minutes, Isaiah, and the floor is yours. Congratulations on this award.
Thank you, Ms. Lannery. Well, first off, I just wanted to say thank you to everybody at SCAGO for providing me with this opportunity. I apologize. But to see that you guys not only put your support in me, not only for the first year of my post-secondary experience, but that continued support's there in my second year, it actually does mean a lot, because it means that I'm seeing that you guys believe in me and believe that we can, or that I can reach my dreams in any way. So yeah, I really do appreciate it, because I'd like to put my scholarship towards helping other Black people and other Black children around the world. So it means a lot to see that the support's there to help me, so we can continue to support our community, because our community can always use a little bit of support. But not even in the scholarship sense, SCAGO has always been there to support me throughout my sickle cell journey. I've been involved, or let me not say my mother and I have been involved with SCAGO since longer than I can remember. I literally remember one day being involved with SCAGO. I wasn't introduced to anything. It's just, that's how long I've been a part of this, and SCAGO has been a part of my life. And I really appreciate that you guys have supported me throughout my entire life's journey. It really does mean a lot, and it means the world to me that you guys have put yourselves out there for me. Thank you.
Thank you so much, Isaiah. Like I said, you guys have been part of the sickle cell family for many, many years. And I remember in those early days of SCAGO, your mother had this amazing gala, supporting sickle cell families that I was part of. And I always know that, she's not only a staunch advocate herself, but she's raising advocates as well. So thank you, Isaiah, and congratulations again. And we are there for you. Continue to be strong and do what you want to do. The sky is your limit. We are here for you. I will call back on Mr. Delaney Ines to introduce our next recipient of the Sholape Grant this year, Mr. Delaney Ines. Thank you.
Thank you, Ms. Lannery. So I have the luxury and the pleasure of introducing and welcoming the second recipient, Ms. Kabibi Bolo. Ms. Kabibi Bolo is a sickle cell peer from Congo-Kinshasa. She came to Canada in July 2019. Her parents passed away when she was 18 years old, and she has a big family. In her family, there are 11 members. 5 are no longer with us because of sickle cell disease. 6 continue to remain with us. 4 are healthy sickle cell trait carriers, and 2 currently are living with sickle cell disease. Kabibi and her sister live in Canada, currently by themselves, but Kabibi is going to school to improve her education and English to hopefully become a nurse one day. And once again, she's an honored recipient of the 2022 Sholape Animashawun Scholarship Grant. And we're happy to be able to provide that opportunity for you, Kabibi. So please, over to you.
Okay. Hi, everyone. My name is Kabibi Bolo. I'm 39 years old. I'm Sickle. I'm a newcomer. My first language is French. So for now, I'm going to school at Santonin College because I would like to prove my English. Before I came to Canada, I was a nurse. So I would like to work like nurse here in Canada. So I'm so happy to have this opportunity to have scholarships. For me, it's so nice. I love it. And in Canada, I live alone. I don't have family. I don't have sister, only me. But I have one friend, he's there. He's Robert Cray. He's my best friend. All time when I have problem, he's there for helping me emotional, because live alone in Canada is not easy. And then I'm also sickle cell. It's so hard for me. So I'm gonna say again, thank you so much for everything you guys you do for me. Thank you.
Thank you very much, Kabibi. And so I know you're French first. Trust me, SCAGO, we're trying to accommodate everyone, French, English, and even other languages. One of the things that we're doing now is we'll be translating our website into French as well. So you will have all resources, materials in both French and English. And that way we can accommodate and support many more people. We're very proud of you, Kabibi, not letting sickle cell be a deterrent to you, but you pursuing your dreams of coming to Canada, and also for pursuing your educational goals. So we're very proud of you, and I would tell you, continue to be part of SCAGO family. We're here for you, and we continue to see how we can support you. So congratulations again, Kabibi, and we know you will do well. We know that. Congratulations. We have Miss Amina from the Sholape Animashawun family on the now she has joined us. So we will ask her in 1 or 2 minutes to just give a quick speech to I would say maybe give a nice speech to recognize the recipients of the Sholape Animashawun award. We have already introduced the family and the reason behind what they're doing. So Amina, if you can give in 1 or 2 minutes as a quick speech to recognize those who have received your family's award this year. Amina.
Good afternoon, everyone. I definitely apologize. I was having some issues with Zoom, and now I'm having issues with my camera. Seems to not be my day. But I definitely want to just start off on behalf of my family, thanking SCAGO for allowing us to present this grant for the past, we're in 2022 now, so that's 12 years, and allowing us to go from, sponsoring 1 student to now sponsoring 2. We appreciate the foundation and the organization for everything that you've done, from, behind the scenes social justice work, to support, to now the WhatsApp group that seems to be growing every single day with people from all over the world. It's definitely inspiring and has, helped my family continue to move forward. And then for Isaiah and Kabibi, hopefully, when the snow is gone, so like let's say next year, we can meet in person. My family does hope that this little token is able to help you further your educations and get you to the goals that you are trying to achieve. Education is extremely important, and we recognize that when you have, something that can hold you back at times, such as sickle cell, it can be extremely hard and frustrating, but we want you folks to continue to strive through and to push through. My family is always here if you folks ever need support. And I guess that's for everybody on the call, ever want to talk to someone, want to rant, want to vent. We love listening. We love supporting. We've been doing work all over. And so this today just, kind of gives us a lot of joy. we're hoping that 2023 we're in person, so I get to meet a lot more people, because yeah, the screen is cute, it's fun, but that physical interaction hits different. And so on behalf of my family, we'd just like to thank everyone. We'd like to congratulate Isaiah and Kabibi as well. You folks are gonna do amazing, amazing stuff. Can't wait to see what becomes of you in these next few years in your education and just the community as a whole. We appreciate you folks for, you know, signing up for our scholarship. And yeah, we just wanna thank everyone for being here today. And then again, thanking SCAGO and everybody involved in SCAGO for everything that you do. Thank you so much.
Okay, Hamina, that's supposed to be 1 to 2 minutes, but you were good. Thank you so much. And thank you to your family for, you know, partnering with us to make this happen. So if you're thanking SCAGO, we need to thank you more, because, you know, with your family recognizing these needs and doing this, there's nobody that you can identify that has sickle cell in your family, but you've now missed 1 year of providing this support to our families. So thank you so much. Thank you so much to the Sholape Animashawun's family. So without taking much more time, I want to thank everyone who is on this call today, starting from my amazing education team, Mr. Delani Ines and Ms. Karen Fleming, for amazing job throughout the year, always planning these sessions. James Bradley has become like a SCAGO volunteer in a way. We do this together every year. Thank you for your comprehensive presentation today. I know that every individual who have listened to your presentation today have gained 1 or 2 new things that they didn't know before. So thank you for impacting your knowledge. Dr. Jason Lauren, I think she's left today. However, we want to thank her for amazing presentation. Dr. Susan Williams, amazing moderator. Ogina and Gail, thanks for sharing your experience. You did not shy from sharing your experience. Thank you so much. We appreciate that. I also want to thank every one of the recipients of the scholarship today for your you know, tenacity, perseverance, and commitment to excelling in life. It is because you want to excel that we are able to help you. So we want to thank you that you're committed to excelling, and don't ever think that there's anything that you cannot do, because you can do all things. I'm going to share one personal story before we close today's session. 1 year, I went to the Sickle Cell Disease Association of America's conference, and I was amazed at the number of individuals with sickle cell disease who said they're doctor this and doctor that and doctor this and doctor. I'm like, how did they do all of the medical education with sickle cell disease? Even I was amazed. And I knew that day, I said, no. Looking at the legacy of Sunday Afolabi becoming an engineer, looking at this many doctors, there is not one sickle cell patient that cannot become whatever they say they're mind to do. And with the advancement in care and treatment, friends, the sky is the limit. There's an amazing young man, Dr. Donnell Hyvee, who has done a few of our peer support for sessions for us. He's based out of US, he's a medical doctor, he has sickle cell disease. And I said to him, how are you able to go through the rigors of the medical school? It's not easy. How do you do it? And he said, hydroxyurea. Hydroxyurea. And I said to myself, hydroxyurea helped him. So I'm not pushing hydroxyurea on anybody, but I'm saying it's amazing medication. If you're a good candidate for it, anybody that's listening to this session, please talk to your doctor and see how you can be on that medication. It has helped him. I mean, that's what he said, that was what helped him to really focus on school, because he was not getting sick, not having the complications, because it was on this amazing medication. Not everybody is a good candidate for it, but those who are, please don't hesitate to get on that medication and do all things that you need to do. Again, pick 2 S's. That's most important to you. Study, sleep. Study, sleep. Eat. Don't forget to eat. But a little bit of social, not too much of social. On this note, I want to thank Dr. Dina Powell and everyone again who's been on this call. And I want to say, until next transition session next year, Have a wonderful, wonderful Christmas and a happy new year.